Now this is a short video to show how you can check if you're unwell enough to go to the hospital due to coronavirus. All you need is two pieces of equipment, a thermometer and a pulse oximeter. There are different types of thermometer, but I would recommend the digital or electronic ear thermometer. The ear thermometer is pretty easy to use. You switch on by pressing the white button, secure the ear probe, insert into the ear and press the green button. After a few seconds, this should bleep and record your temperature. A normal range of temperature is between 36.1 to 37.5 degrees centigrade and depends on several factors such as age, hydration, clothing, exercise and weather. If your temperature is 38 or above and you have symptoms such as headaches, sore throat, then you should take some paracetamol and recheck again in 45 minutes to an hour. If it's still not improving, you can take ibuprofen 2 hours after your paracetamol dose and recheck again in 30 minutes. The pulse oximeter. A normal saturation should read above 96%, assuming you're not a smoker, and have no underlying lung condition, by which we'll compare with your usual baseline reading, which could be anything from 92 to 94%. So if your SAT is below 3% of your normal reading, then you should speak to a doctor for advice. A good way to check your oxygen levels is by using the desaturation test. This involves walking 40 steps with the SAT probe attached and checking your oxygen levels after exertion. For instance, a change in SAT from 98 to 95% is significant and you should speak to a doctor or a nurse. Now I'm going to show you how to use the pulse oximeter. The BPM at the top reads the pulse. SpO2 reads your oxygen levels in the blood. So switch the SAT probe on and insert it into any finger. And it should take a few seconds to read. As you can see, my resting pulse is in the 70s, and that changes as I'm talking, while my oxygen levels is at 97. So now I'm going to walk 40 steps and check my oxygen and pulse levels after exercise. You can see that after my exercise, my pulse levels have gone up to 107 and my oxygen levels has dropped by 1% to 96. Now as I'm more relaxed, I should expect the pulse to start coming down while the oxygen remains stable. I'll avoid using a smartphone app to check oxygen saturations as they have not been validated, and I'll recommend you buy a pulse oximeter through online stores such as Amazon or from any pharmacy. The pulse oximeter or SAT probe is more important than a temperature check, especially if going into week 2 or week 4 and the fever is gone but other symptoms such as shortness of breath or fatigue remain. In some cases you might have what we term silent hypoxia. This is basically where you have no breathing difficulties but your oxygen is lower than normal. A normal pulse is between 60 to 100 beats per minute, depending on your age, physical status and other factors such as stress and anxiety. You can also count your respiratory rate by placing your hands on your upper abdomen and counting the movements for a minute. A normal respiratory rate is between 12 to 20 for adults, while above 20 is an indicator that you have breathing difficulties. Your respiratory rate is an indicator of how fast you're breathing and if you're struggling for breath. So the parameters to check will be your pulse, your respiratory rate, your oxygen and your temperature. A normal resting pulse is between 60 to 100 beats per minute. A normal respiratory rate is between 12 to 20. Your normal oxygen levels should be above 96 and your normal temperature readings should be between 36.1 to 37.5. If there is any change in any of these parameters, you need to speak to a doctor or nurse. Now if you like this video, please share and subscribe to my channel and look out for more videos on the coronavirus.